So I'm here today with Dr. Elizabeth Buchbinder, and we are going to be talking about the latest research in skin cancer and melanomas. Dr. Buchbinder, could you maybe give us a little bit of an introduction to your research interests and your clinical practice?
Sure, absolutely. So I'm Beth Buchbinder. I'm at Dana-Farber Cancer Institute in Boston, and I am entirely a melanoma physician. So I treat melanoma, I do research in melanoma, I do a lot of work in the early drug development as well, so testing new drugs in melanoma, but also have a lot of interest kind of along the spectrum. So in terms of immunotherapy in melanoma, targeted therapy in melanoma, also refining melanoma therapies and looking at outcomes for patients kind of down the line, including some survivorship work. So kind of run the gamut, but really focus on melanoma in particular.
Great. And it's really exciting to have this conversation today. We're going to be talking a little bit about ASCO 2023. And I'd love to hear from your perspective, what were the exciting topics, the hot topics that everyone was talking about with regards to melanoma at ASCO 2023?
Yeah, so I think there are quite a few. I would say 3 or 4 really hot topics in melanoma right now. And so I'll start with one of the early stage ones, which is the mRNA vaccines, or as they're kind of becoming more named, the individualized therapy, because what they're doing is taking the neoantigens, basically figuring out what the neoantigens are on tumors and then creating an mRNA targeted therapy that then allows the immune system to kind of get to know those antigens and react against them. And so there's really nice data in the adjuvant space, so in the preventative space combined with pembrolizumab, demonstrating that it can lower relapse-free survival. So there's tons of excitement in that space and looking at different kind of antigen products that train the immune system. So a bit like vaccines, but kind of different because they're not going to be universal. They're really individualized. And so looking at these sorts of products. And so that's one area that's incredibly exciting right now. Some really nice data from Moderna and Merck looking at that. And there's going to be phase 3 trials coming. So a lot of buzz around that space. The second space, I think there was a lot of excitement at ASCO is around the LAG-3 targeting space. So both with Relatlimab as well as, and I can never say it, Fianlimab. So a new drug targeting LAG-3. There's been some real exciting data. Both so on the with the Relatlimab, basically a revision 2 years worth of data from that trial, really demonstrating continued benefit in terms of progression-free survival and overall survival, which is very exciting for melanoma in the front line. And then with the Fianlimab data, basically demonstrating some nice responses. And so another potential agent to be investigated going forward. So those were kind of the big areas there. The third area where I think there was some real excitement at ASCO, and not so much in terms of presentations, but just buzz in the background, is with cellular therapy, as we're hoping maybe for approval of some TIL therapy products in the future. And so just kind of buzz around that. There was discussion, although not so much abstracts at this particular meeting. And then the final area, which actually really is exploding in melanoma, is the neoadjuvant space. So the use of these drugs earlier and earlier in the treatment of melanoma, so before surgery. And there were some nice presentations. There was actually a clinical science symposium about neoadjuvant therapy that included some of the work being done in melanoma. And I think that's a space where not only are we seeing benefit of neoadjuvant therapy and giving immunotherapy before surgery, but there's also a very, very active effort to figure out how to tailor that, what is the best therapy in that space, and what is the best timing. Can we change surgery based upon responses to neoadjuvant therapy? What other markers can we follow? Things like ctDNA and other things to figure out how we determine how much therapy or surgery patients need. And so that's a huge area that's kind of very, very active right now. And that there were a lot of presentations around that at ASCO.
Super exciting. There's lots going on in this space. If you were to look at ASCO 2024, and between now and then, some of the exciting work that's going on in melanoma. What might we expect to see everyone talking about at ASCO 2024?
Yeah, so I think what we're likely to see is combinations moving into that neoadjuvant setting. So we talked about LAG-3. There's some other interesting targets and interesting combinations with PD-1 inhibition that I think we'll be seeing in that neoadjuvant space, hopefully allowing us to better figure out what are those best drugs to give up front before surgery, and then also can we use those to tailor surgery. So I think there'll be some really interesting data in that space. I think the other thing are going to be some novel combinations that we may see, and then also adjuvant data. So adjuvant data with LAG-3, adjuvant data with some of these other successful combinations. I think we may be seeing more of that kind of into ASCO 2024. And then who knows? There are always, trials ongoing that surprise us and new, exciting, phase 1 drugs. I think the other space that kind of has gotten forgotten at ASCO this year, but where we're seeing kind of some interesting data is the targeted therapy space and getting better at doing different sort of targeted therapy approaches. And maybe we'll see something there next year.
Super exciting. Dr. Buchbinder, thank you so much for your time today. I'm really grateful for that really super overview of melanomas at ASCO 2023 and a little glimpse of what's going to be coming down the line. So thank you so much for your time.
Absolutely. Thank you.